Edutainment Studios welcomes you to Living with RA, Tips and Tools. This module is part 1 of a 4-part series on rheumatoid arthritis. Rheumatoid arthritis, also known as RA, is a chronic inflammatory disorder that can affect more than just your joints. In some people, the condition also can damage a wide variety of body systems, including the skin, eyes, lungs, heart, and blood vessels. An autoimmune disorder, rheumatoid arthritis, occurs when your immune system mistakenly attacks your own body's tissues. Unlike the wear and tear damage of osteoarthritis, rheumatoid arthritis affects the lining of your joints, causing a painful swelling that can eventually result in bone erosion and joint deformity. The inflammation associated with rheumatoid arthritis is what can damage other parts of the body as well. While new types of medications have improved treatment options dramatically, severe rheumatoid arthritis can still cause physical disabilities. At the end of this course, you will understand how a patient should properly use their joints and how joints work. One of the first steps to caring for your joints is paying attention to how to use them. You can help protect your joints and reduce everyday strain by making small changes in your routines. A great way to start is by switching between different activities or types of movement. You can follow these tips. You can switch between using and resting a sore joint. You can change your position often. Try not to stand or sit for too long in one place. You can gently stretch several times a day. Tilt your head and neck from side to side, bend your legs, and move your arms and hands around. You can use your strongest joints when possible and save your weaker joints for tasks where the use of them cannot be avoided. You can talk to your doctor or physical therapist about your posture. Ask if you are standing, sitting, or walking in a way that stresses your joints. You can help ease symptoms by learning new ways to do everyday activities. Your doctor or an occupational therapist can give you ideas. First, try starting by standing up from a chair. Use your thigh muscles or push yourself up by placing your palms on the arms of the chair. Another way of lifting or carrying large items is by squatting and then pushing straight up instead of bending over from the waist. It will help if they carry items close to their body using their palms or arms instead of their fingers. Picking up smaller items can be done by sliding them off of the countertop instead of pinching their thumb and forefinger together. A book can be held in your palms instead of bending your fingers. Or you can lay it flat on a table or on a pillow in your lap. You can carry a purse or a briefcase by using a shoulder strap instead of clasping the bag with your hands and fingers. Or you can try a backpack if you have shoulder pain. Please feel free to investigate these other sites for more information, and remember to bring any concerns or questions in to discuss with your doctor. Thank you for joining us today for part 1 of this 4-part series on rheumatoid arthritis, and come back for part 2.